UNAC UHCP, you made a difference. Your presence here on July 8th, showing how powerful we are and that we are going to let KP hear us, made a difference.
And we're here today because we know that your strength comes from your solidarity. It comes from standing together and speaking with one voice. We know that you are the heart and soul of Kaiser. And that by taking the time to come out on a Sunday and stand together, you're not only fighting for one another, but you're fighting for your patients. You are fighting for your patients.
I'm the daughter of a nurse, and she knew that the only way to have any kind of relationship with management and be able to take care of her patients is if they could do it collaboratively, if workers were listened to, if they were respected. Because those workers in healthcare, we know, most of the time are trying to bargain for things that will help their patients, and that's what you're doing here today.
You are the ones who make the union strong. So keep doing what you're doing. And you know, Kaiser's very lucky to have all of you. Kaiser's lucky that all of you come to work every day and you care and you love your job and you care for their patients, your patients. So now it's time for Kaiser to step up. It's time for them to step up and take care of all of you. Because what you're asking for, that's right.
But in here, the commitment to patient care exceeds all other standards, at least as I've seen them. And it is a great feeling.
Real change only can happen through standing together with your union, bargaining in good contracts, keeping people accountable, holding their feet to the fire, and ensuring that you all stand together when it matters most. This is that time. This is that time within your unions. This is that time within Kaiser bargaining. This is the time within the entire United States to make sure that happens. ¿Sí se puede?
So we have finished day 2 of session 4. Minimal progress made within both subgroups. This bargaining has been like no other interest-based bargaining I have experienced. We've had barriers upon barriers. We don't have the right decision makers at the table. The work that we should be able to be doing and moving forward is not happening.
As we conclude 2 days of bargaining, one of the things that angers me the most is the language out there that the employer has proposed to take away our no KTO protections.
Instead of working on recommendations that were supported by both management and labor, they worked their recommendation. They came back with new contract language, totally disregarding our local agreements, totally disregarding our conversation we've had again and again. They came back with new contract language, spelling out in what order they're going to cancel people.
I got involved with the union in 1985 because I couldn't make my mortgage payment. I was canceled 2 or 3 days a pay period. I had 2 jobs as well as my coworkers. Within a few years after coming aboard, I was canceled at Kaiser Permanente, and we fought hard for the language that we have in our local and national agreements. I encourage everybody to get after this issue. I want you to stand firm and stand tall and stand with us. Every one of us deserves a full paycheck. You cannot survive, you cannot build your pension without being able to work the hours that you are hired to work. We need more full-time workers, not less.
Canceling staff makes no sense at all, and it doesn't make any sense at all that those that are not taking care of the patients are trying to define it. It's wrong. It's their recommendation. but it's going to be before the full CIC on our next bargaining session. We have 2 new dates to complete our work. August 28th and 29th. You better be here.